Hello, and welcome everyone to the Oregon Office of Rural Health's MBQIP Educational Webinar Series. Today's presentation is titled MBQIP Program Patient Safety Measures. My name is Carrie Beck, and I am a project coordinator with Health Insight Oregon, and I'll be your facilitator and presenter for the event today. Health Insight Oregon has partnered with the Oregon Office of Rural Health to provide education, technical assistance, and opportunities for peer-to-peer sharing for critical access hospitals participating in the MBQIP program. This event will be recorded, and the recording, the presentation slides, and other materials used during the webinar will be available on the Health Insight website. There are 4 objectives for today's presentation. The first is to review the basics of the 2 MBQIP patient safety measures. These are OP27, which is the healthcare worker influenza measure, and the IMM2 measure, which is the inpatient influenza measure. The second objective is to understand the importance of reporting these 2 measures. The objectives include to know where to find resources for reporting or improving these measure rates, and then to share with and learn from peers with successful strategies. Today's agenda includes outlining the basics of the 2 measures, reviewing the intervention tools and resources document, to hear from high-performing cause and include a facilitated discussion with Q&A. These 2 agenda items will not be covered during the recording today. And then finally, we will give a reminder about the Oregon Rural Health Conference Workshop, which is specifically for critical access hospitals in Oregon. All right, first we want to hear about the MBQIP program, or the Medicare Beneficiary Quality Improvement Project. The program is under the umbrella of the Medicare Rural Hospital Flexibility Grant Program, also known as the FLEX program. The lead organizations include HRSA, Health Resources and Service Administration, the Federal Office of Rural Health Policy, and the each state's Office of Rural Health. The goals of the MBQIP program are to increase quality data reporting, to drive quality improvement activities based on data, and to improve the quality of care in critical access hospitals. The measures under the MBQIP program fall into different categories. The first one is they are either required measures or additional measures, which are optional. The measures fall under 4 domains: patient safety, patient engagement, care transitions, and outpatient. Today we will again be covering the 2 patient safety measures. Here's a look at a snapshot of a slide from the National Rural Health Resource Center website. You see the 4 categories that we just mentioned, and the 2 measures under patient safety. So first we are going to cover the OP27 measure, which is the influenza vaccination coverage among healthcare personnel measure. All types of healthcare settings are required to report this measure. And in Oregon, this measure is mandatory. And you are required to report influenza vaccinations and documented contraindications and informed declination rates for all staff. And there is a fine associated with not reporting this measure. Failure to meet the annual May 31st deadline may result in fines of up to $500 per day. They're looking at the reporting instructions for this measure. It's important to note that the federal and state due dates at this time do not align. We mentioned the state deadline is May 31st and the federal deadline is May 15th. The Oregon Office of Rural Health is, the Office of Rural Health is currently working with the Oregon Health Authority to align dates to the federal due date of May 15th. The reporting period covers the full flu season of October 1st through March 31st, and data can be entered monthly or quarterly. Now, this measure was designed to ensure that reported vaccinations are consistent over time within a single healthcare facility and comparable across facilities. It's also important to note that only cumulative data should be entered. Any new data that are entered into NHSN will overwrite and replace the previously entered data. Thus, if a facility would like to keep track of its monthly numbers, it should maintain its own records of this, as it will not be able to review monthly reporting numbers in NHSN. Tracking should result in increased vaccinations and reduced morbidity and mortality among patients. Now, looking at the measure specifications for OP27, the denominator are healthcare personnel who are physically present in the healthcare facility for at least one working day between October 1st and March 31st. And there are 4 categories of employees, the first 3 being required and the 4th being an optional category. So the categories of required healthcare personnel that you must report on are employees, licensed independent practitioners, and the category including adult students, trainees, and volunteers. Now, there are definitions for all of these categories, and I won't go into them now, but they are available at the resource listed at the bottom of the slide. The 4th category is optional, and that includes other contract personnel. The numerator for this measure includes, there are several bullet points about this numerator. And these bullet points include they have received the flu shot administered at the healthcare facility. They've reported it in writing, that can include paper or electronic, or provided documentation that they received the flu shot elsewhere. They've determined to have a medical contraindication. They were offered it but declined the vaccine and had an unknown vaccine status or did not otherwise meet any of the definitions here. This slide outlines the importance of reporting this measure. First and foremost, reporting this measure follows national recommendations. The second bullet outlines the research that exists for the benefits of influenza vaccination of working age adults. Research has shown that it reduces the risk of the flu illness. It reduces work absenteeism, reduced antibiotic use, reduced medical visits, and then reduced death among nursing home patients and elderly hospitalized patients. Several organizations document best practices for improving rates for the influenza vaccine for healthcare workers. And I've pulled them all together into one slide, and these best practices include hiring leadership who support vaccinations, offering vaccinations to all staff. That includes employees who work night shift, weekend shift, and temporary workers, and making this vaccination convenient for the employee to access and free of charge to the employee. Providing education on the benefits of receiving the vaccine and then the potential health consequences of not receiving the vaccine. Participating in yourself and encouraging promotional campaigns. These would include campaigns like mass vaccination fairs, where you might include other health-related activities like screenings, incentive programs where you have potential giveaways, raffles, etc. These could include social media campaigns. The next bullet point is obtaining signed declinations for anyone declining the vaccine. And then consider adopting a policy requiring healthcare workers to wear a mask or identify themselves as not having received the flu vaccine if they have declined it. This is a table looking at the mean healthcare worker rates for all healthcare workers over or since the 2011-2012 flu season. And you can see Oregon healthcare workers have been improving, or this rate has been improving steadily. As of the last flu season, we are at about a 70%. And with the healthy people 2015 goal being 75%. So we have a little ways to go there. We're inching toward the 2020 goal, which is defined as a 90% rate. So we are making slow and steady progress, which I commend all of you for. This next slide comes from the same report, which is a report put out every year by the Oregon Health Authority on this specific measure. So this measure looks at 4 healthcare settings since, again, the 2011-2012 flu season. And it shouldn't take long to see that hospitals do have the highest rates of the healthcare settings in the state of Oregon. And let's see, so, this gives a good indication about where we are and where we need to go and the differences across healthcare settings. So taking a look at the actual reporting of the OP27 measure, these next slides I'm going to go through rather quickly, but they are screenshots that you can refer back to if you are in the process of reporting this measure. So this is the OP27 is reported again through NHSN, the National Healthcare Safety Network website. And this is a picture of the homepage. You can see from this measure, this is where you are adding a monthly reporting plan, and there is specific directions on this page. At the end of this, or excuse me, you'd want to make sure you're clicking the influenza vaccination summary and clicking save. On this page, you're continuing to report. Influenza and seasonal are your default choices, and then you want to pull down the appropriate flu season in the drop-down box. This is a page which I'm sure many of you are familiar with. It shows the 4 categories of employees which we discussed earlier, and then the numerator requirements, which we went over earlier, and you would fill in all the columns. The first 3 columns are required, and then again the last column is optional. And then when you want to make sure you enter 0 when no employee would fall into that category, and then you want to click save. A message confirming that the data were saved will appear at the top of the screen, and you can run a report to confirm. A reminder, always generate a new data set on entry before exiting and before running reports. It's an important reminder. Okay. Okay, now we were going to move on to the next measure, the IMM2 measure, or the influenza immunization for your inpatients. The reporting method for this measure is in QualityNet, and it's reported via a inpatient cart or through a vendor. You'll see the sample size is between 153 to, or excuse me, your sample size is 153 if you had between 153 and 764 inpatient discharges during the year. If you had anything less than 153, your sample size would be 100% of your patient discharges. You enter this in the global category and population and sampling. And then a note is that this measure is submitted quarterly, but data are only calculated based on the 6 months of the flu season, and they are reflected in the Q1 reports. So again, we will look at the measure specifications of this measure. The numerator is defined as the inpatient discharges who were screened for influenza vaccine status and were vaccinated prior to discharge if indicated. And then there are several inclusion criteria listed here, which I won't read through, but you'll want to take particular notice of those. The denominator are hospitalized inpatients 6 months and older who were discharged during the flu season months, October through March. And then again, there are several exclusion criteria listed here. And hospitals may wish to analyze the measure data by individual high-risk populations, for example, including patients with diabetes or potentially with COPD. And this would be in order to determine if all defined high-risk populations are equally vaccinated, or if there are opportunities to improve care to a specific population of patients. So again, this measure is reported in QualityNet, And I've included a link here which has screenshots of reporting for this measure. I'm not going to go through them in such detail as I did OP27. But the basic instructions are to identify the measure population, to enter the inpatient population and sampling count, to abstract the CMS inpatient measure data using CART or a vendor tool, submit the data to the CMS warehouse, and then to check your submitted cases for quality assurance. So looking at rates, both national and statewide, and these rates are taken from a Telegen report, and the national median rate for critical access hospitals is, as of the fourth quarter of 2016, 85%. That same measure, looking at critical access hospitals in Oregon, was 77%. So I'm going to spend just a little bit of time reiterating the importance of reporting this measure, which is equivalent to the importance of vaccinating in patients with the influenza immunization. I'm sure some of this is review, but I think a good reminder for all of us. The flu vaccine is the most effective way to prevent flu and its complications. Every season, 1 in 5 people get influenza. And combined with pneumonia, influenza is the 8th leading cause of death in the United States. And up to 2/3 of all deaths occurring in this population of patients that were hospitalized during flu season, regardless of their age. And vaccinating in a hospital is a known underutilized opportunity. Here's the graph that I think is very telling. It's from an expert in the field, Dr. David Kim. And this is showing the number of cases and number of hospitalizations that were averted by vaccinating with a flu shot. So you'll see on the bottom axis that we're looking at the flu seasons of 2011 to 2012, all the way up to 2015, 2016. So it's a little bit outdated, but the message is clear. On the left side, we are showing that the number of hospitalizations averted during the 2015-2016 flu season was just over 70,000 hospitalizations averted. And on the right axis, you will see that in the 15-16 flu season, that roughly 5 million cases of flu were averted from immunizations. And what are other impacts from the influenza? I think important statistics here are the direct medical costs of over 10 billion, and then with the loss of work and life, roughly 87 billion. These are important reminders of the importance of the flu vaccine. This slide was taken from a presentation that I was able to attend during a recent national immunization conference. And it is looking at some preliminary data of the flu vaccine effectiveness from the most recent flu season. And these preliminary results are showing that the flu vaccine was 43% effective. And so I think, this data was also showing that the vaccine was well matched to the circulating influenza virus. So that's important information to share. What are the best practices for the IMM2 measure in the hospital setting? They are, of course, to train and to educate your staff, to use protocols and standing orders and adopt policies, to properly store and handle vaccines, to incorporate vaccination into patient flow, to document this information into your electronic health record and to the Oregon State Immunization Information System, also referred to as Alert IIS, to provide a strong recommendation to your patient, to reduce barriers for your providers and patients, and then to implement the adult immunization practice standards, which we'll review in more detail on the next slide. So to review, what are the adult immunization practice standards? These are a call to action for healthcare professionals to assess the immunization status of all patients at every clinical encounter, to strongly recommend vaccines that the patients need, which has been shown in much research is a motivating factor for many patients on whether they will receive the vaccine, to then administer the vaccine or refer to a provider who can immunize, and then to document the patient or the information in a state vaccine registry. So a couple of resources I wanted to point out are, I have developed a intervention tool and resources document that focuses on the two measures that we have just reviewed. This document includes resources for those who are preparing to either report the measure or are looking to improve the measure. And this is a direct link to that document. And then Health Insight has also developed an interventions toolkit for the hospital setting. And there is a direct link to that toolkit as well. So this is a look at the objectives for today, which we've reviewed the basics of the measures. We've looked at the importance of reporting the measures. We've looked at where to find resources for reporting or improving the measures. And if you were on the live roundtable call, you were able to share and learn from peers with successful strategies. If you were not able to be on that call and you'd like to be in contact with hospitals who are doing very well with these measures and you would like to be in contact with them, please reach out to me and I can connect you with them. At this time, if we were live, we would take questions and comments. And we would hear from these two hospitals, St. Anthony Hospital and West Valley Hospital, for these two measures. I want to remind everyone about the workshop that is being planned for critical access hospitals, all of you at the Oregon Rural Health Conference on Wednesday, September 18th. You should have received information via email about registering for this workshop and the conference. Okay, well, I am going to end the webinar now. Feel free to contact me, Carrie Beck, for any questions you might have. Here is my email and my phone number. I'm signing off now. Hope all of you found this webinar to be useful, and I look forward to hearing from you.